Okay, let me actually, oh, did I? No, that's showing applications. These are my questions. I don't need those. Well, you can read them if you want, but what I was, okay. Anyways, I think I need to ask you that one more time. So it's okay if I record this, right?
Okay. Yep, it is.
Okay. So how how did you first hear about VSee?
Let me answer a VC question here real quick. There we go.
Okay.
I actually have on my screen also the VC chat. And one of the nurses was asking me a question, so there she goes. Anyway, well, we actually first learned about VC, and in my mind, it was one of those God moments that we had been looking at different telehealth models, different telehealth kits, and the cheapest one we could find was about $25,000. For a practice with a dozen people, it wasn't an option for us to invest in something like that. And so we had tried a couple of different options. We had considered using like FaceTime or Skype or something like that, and found that there were all kinds of roadblocks with that because it wasn't HIPAA compliant, et cetera. And the particular year I was scheduled to go to the Northwest Telehealth Regional Conference with NRTRC. And I couldn't go, but my office manager did. And so she happened to run into a young man that she was describing her frustration to this young fellow at the conference that, you know, we can't find something. We've got all these mountains. There's, you know, the satellites or valleys go this way and the satellites go that way. We can't use a sat phone. You know, what are we going to do? And he was so excited about VSee, and he shared with her, well, you know, we have a very low bandwidth program that's useful for cell phones, you know, computers, whatever. And so we started a conversation with him, and I guess it was probably about 3 years ago now, just to find out more about the program, how we might be able to implement it. And I have to tell you, I am one of the least techie people in the world, and I just about wept when my oldest daughter left home because I no longer had IT support for my computer. And so as we started looking at VSee, then we were able to discover that, hey, this is something that the other barrier for us was the cost of IT support for a very small practice. And one of the things that they had told us at the telehealth conference is you have to have robust IT support. We couldn't afford that. And so as we were looking at programs, we kept ruling out program after program that wasn't going to work in our area, but it was quite possible that VSee could, because all we really needed in the facilities was Wi-Fi. Most of the facilities had Wi-Fi. We had to make sure that it was a strong enough signal from patient to patient room, and their own IT could take care of that. And then on our end, we had to have a decent sending unit. So it was actually the final program we were able to rule in because of the very low bandwidth that it used. Anyway, that's kind of how we got connected with it, and the rest, I guess, is kind of history. Uh-oh, I think we dropped here.
Oh, no, I'm right
Your
here.
video froze. There it is. Okay.
Okay. Okay, so kind of, do you mind if I ask, like, what are some of the other things that you're looking into?
We had looked at, I'm trying to remember some of the different kits that we looked at. The names don't even stick in my mind now because I ruled them out so quickly that because of the cost of the kit, I couldn't afford. They had one kit that was $75,000, another one $50,000, and I'm like, you can afford one kit for 5 counties? Are you kidding me? Yeah. And so the first grant that we were able to get was about $25,000. So then we started experimenting more with, well, how can VSee work? And what does our sending unit have to look like?
Okay. So you were actually looking for kits in the beginning.
Yeah, we thought that what we would have to have would be a kit that had a stethoscope and some things like that that were compatible with it. Um, what we found actually had worked with, and I can't think of her name offhand. Um,
Becky?
yes, Becky. Worked with Becky on finding devices that would work with iPhone or cell phone, and she
Mhm.
was able to help us to kind of find devices that were FDA approved that we could get good enough sound through the cell phone or iPad or whatever, and select down on the different kits. And I wonder if I've still got a picture. I'll have to bring up a slide of our current kit. And I think I sent Milton a picture of our latest kit version. The kit itself is about the size of a piece of paper.
Mm-hmm.
So it's about a 9 by 13, I think, size plastic case that has the cell phone enclosed in it. It has a stethoscope section in it. It has a little rhythm strip that's about so big so I can get a
Mm-hmm.
cardiac, basic as this person in rapid heart rate or whatever. A scope for looking in the ears and a scope for looking at the skin. The total cost of that kit, depending on the pieces that I put in it, is about, and I can get a used iPhone now for cheap. So
Mm-hmm.
the kit cost is anywhere from $1,500 to maybe $2,500, depending on what I put in it. The stethoscope and the dermatoscope are the two most expensive pieces. Those are about $500 each. And the cell phone, of course, is anywhere from $200 to $600. Or if somebody donates an iPhone, I refurbish it, put it in a kit, send it out to a patient. So
Okay. Well, if I have friends who have used iPhone, I'll know where to send them to.
there you go. Yes, when your iPhone ages out, send it over. Yeah,
Okay.
so if I have 100 listeners and there are 100 used iPhones, I'm in good.
Okay. So it sounds like the most important features for your particular workflow for VC is mainly the low bandwidth and just kind of the easy way that you can
Yeah,
just call up and chat with
yeah,
people.
yeah. It has to resemble a cell phone call and a cell phone text. Honestly, is it seems to be the most frequent things that I run into. Because if I can't teach a nurse at a facility how to use it in 5 to 15 minutes, it's over. They can't handle more information than that when they're in the middle of a busy shift.
Mm-hmm.
But most young people know how to take a picture and send a text message, and that's what VC will do. And that gets the patient quick care. The stethoscope, the things that would make it more user-friendly, I had talked a little bit to Sam from MedWand,
Mm-hmm.
and I so wish that he would get that one unit together where there's
Yeah.
stethoscope, dermatoscope, otoscope in one head,
Mm-hmm.
because if you had that and you had a cell phone, in my mind, it would be just totally the perfect kit.
Mm-hmm.
Small, compact, easy to use, plug and play, and we would just be so in love with those little things. So, and it was so inexpensive, the unit that he was talking about. And for the smaller communities, cost is a big deal. A small facility, when we started talking to the facilities about, oh, your kit's only going to be $5,000, it was like, eh. But if we talked about that with them, well, we provide the kit. We did fundraising for the kits. We will support the kit. We'll take care of the phone updates and things like that. And all you need to do is use an alcohol swab on your kit. If you're taking it into an isolation room, your phone goes in a Ziploc baggie. Do not expose that phone to your infected patient. So anyway, so we've got protocols in place for what do you do if it has to go, on yucky skin or scabies or whatever. We don't want to spread those things. And so those, we put protocols in place as far as the cleaning of the kit, the maintenance of the kit, and so on and so forth. So those were a lot of the moving pieces that made the initial launch of the program pretty challenging.
Okay. Let's see. Um, so, okay, so I'm going to switch gears a little bit and kind of want to kind of understand kind of you and what you do in general, and kind of your responsibilities, and what it's like to, I guess, be in your shoes. So maybe, so what would you say are your main responsibilities? Oh, did we freeze a little bit? Oh, I think we froze just a moment.
Uh-oh, lost our audio.
There we go. It's back.
Okay. Okay.
Yeah. So I think we're just switching gears a little bit, finding more about you and what you do. So what would you say are your main responsibilities, and how do you get measured by your job?
How do I get measured? You mean as far as whether I'm providing good service, or?
Yeah. Well, how about let's start with what are your responsibilities? Like, what are you supposed to be doing?
I do everything. Um, I'm a wound care nurse practitioner, and so my responsibilities are supposed to be taking care of patients. And so in general, I go to the facility, in normal work, I would go to the facility, make the visit, and my billing service then bills Medicare. I was originally the executive director for On-Site for Seniors, and now I'm just simply on the board. And so I still tend to do some of the speaking for On-Site just because there seems to be a need for it. We currently have 4 employees that are all part-time. So we're a tiny little business, and so that's why I say I do everything. We have IT service, but honestly, I haven't used IT support now for VSee in a year, because after the initial IT support with helping me to figure out the program and what this meant and what that meant, once I got it, I really didn't need IT support. So it was a huge benefit.
Okay. So at the time you got VSee, you were still the executive?
Yes.
Okay.
Right.
Do you need to get that?
A little bit. So yeah, at the time I started with VSee, yeah, I was the executive director, and we also still were seeing patients physically with a larger staff of physicians and nurse practitioners. Because it was hard to sustain the practice with just the in-person model, we moved all of our staff that were medical providers over to our community health center, because there's a special reimbursement for those Medicare and Medicaid and low-income patients. And so it was a much more sustainable model for that particular no telehealth kind of model.
Mm-hmm.
But we felt like the home patients still needed to be seen, and the community health center does not get well reimbursed for specialist visits, which is what I am. And so what we needed to do was we separated that telehealth piece, and we took the telehealth and specialty care. So we have Dr. Melchiori, who is a geriatrician that does dementia care, memory care visits, and she does those remotely as well as in person using the hybrid model also. So my role now is I kind of manage and maintain our telehealth program. I don't have that official title, it's just that there's only 2 of us and somebody's got to do it, so there you go. So I'm the person currently that puts the programs on the phone, checks the equipment, figures out how it's going to work, helps write the protocols, pretty much all of it. And so I had some wonderful help from the community health center while we were with them, getting the protocol development and the procedure development piece in place. And so I have a really good set, I think, of protocols for the skilled facility and assisted facility setting for their nurses because of, you know, their that they're surveyed on a regular basis by the state. They need to have protocols and procedures in place in that setting to cover them, make sure that their nurses are providing visits in a way that's cohesive with what they're supposed to be doing for HIPAA compliance and so forth.
I see. Okay. So what would you say are some of your biggest challenges on your job? And maybe you could talk about both your past role and your current role.
Okay.
I don't know if those challenges are different, but
yeah, I think actually in both roles, time management is probably one of the biggest ones.
Can you teach me?
Yeah, exactly. And I think that the busy professional, for me, one of the earliest difficulties was just learning to use VSee because the initial product that you had is a little different from what you have now. The one that you have now is much easier to use, and I don't know whether it's because I've been using it now for a while that I'm just so much more comfortable with it, or it's more user-friendly, or it's both. But it takes me much less time to deal with program management and development because you guys are managing that portion of it now. And doing a really nice job of it. The updates that I see coming through are usually very user-friendly, and I don't have to log on and see how am I going to use the new update. If I can't figure it out, nobody in the arsenal of people that are going around with units are probably going to figure it out either. So I don't have to. I very much appreciate that the updates have made it more and more user-friendly.
That's good to hear.
So I would say, you know, that's one of the big pieces for me. And with the user-friendly updates, it helps with my time management because I'm not stumbling through how to use the stuff. And how do I connect the stethoscope? You send a good little update with, okay, now you can improve the audio on your stethoscope by clicking this. Okay, I can do that. I'm good. So
before when VSee updated, you had to relearn everything. It sounds like what you're saying. Okay.
Yeah. Yeah, I had to start back over with, okay, where is that? Was that hidden under settings or was that under the audio or the camera? Yeah, and fortunately VSee doesn't have a whole lot of buttons.
Yeah.
Good thing for me.
I think it's a good thing for all of us. I mean, that's the thing with
3 buttons.
yeah. Well, this go to webinar, right? For my, I think you have a sort of, as a panelist, you have a sort of a dumbed down, I want to say, version of it, so you don't have quite as many buttons as I do. But for me, it's
I think so. I've got a microphone, a video, and a slide button that I have identified now.
Yeah.
And so that's good. There's just the 2 of us on there, and I've got a text box, and I can deal with that. Yeah, if it gets much more than 4, I'm overwhelmed.
Yeah. How do you get new information? Like, you know, when you need, because it sounds, I mean, because you know that telehealth rules are changing, and you know that. So where do you get your knowledge about, you know, telehealth or about wound care? How do you stay updated?
You know, most of the time we're gathering those either from the Medicare website is one of the places that I get it. Another is the different organizations that I might be part of, like the American Telehealth Association is a good resource. I get a lot of my information from the Northwest Regional Telehealth Association, mainly because that coalition deals more specifically with our region, which tends to lag behind the rest of the nation. So
Mhm.
it kind of helps me to know where things are at for Wyoming and North Dakota and, Idaho and all that. So
Mhm. Are
helps
you
me look.
part of, yeah. Are you also part of, so how about for wound care? Like, are those like, do you use, are you part of magazines or other associations?
Yeah, that one, I have to think of their initials now. The American Association for Wound Care. So the Society for Advanced Wound Care, sometimes they'll have some information, but a lot of those, unless they happen to have a session devoted to that at one of the conferences, I don't hear as much about it. There was one presentation on telehealth at one of the recent Society of Advanced Wound Care or Symposium of Advanced Wound Care um, seminars that was held. So I was encouraged to see that starting to be more a part of it. And I think it was the same gal that did, it was a Northwest Regional Telehealth Association presentation. She ended up presenting also at the wound care seminar, and
Mhm.
that was pretty cool because and she strikes me as somebody kind of like me that it's, I'm not the techie person, but we need care for these Alaska natives out in the Tules, so you know. And she's done really quite well with it. She's using a different program. They can do store and forward up there, and it's reimbursed.
Mm,
And that was
that's
one of the
great.
barriers for us is in Idaho, it's not reimbursed. We're not considered, I guess, rural enough,
Well, I
even though,
think they aren't, isn't Medicare just, or I feel like I just heard news about they're getting ready to pass or they're testing store and forward reimbursements for
yeah,
a while.
yeah,
So it's supposed to,
they haven't traditionally done that except in Alaska and Hawaii.
mhm,
And so, yes, if they are starting to do that with store and forward and make it reimbursable for Medicare, that would be huge for us because there are a lot of places in our area with the mountainous area, cell phone even isn't going to work. They still
mhm,
have telephone, plain old telephone systems in the
mhm,
homes that they communicate by. Their cell phones won't work. You can't even get enough bandwidth for a call.
mm,
So, yeah.
yeah. So, do you prefer, so how do you prefer getting your information? Like by website or going to conferences or magazines or I don't know.
Um, that's a good question. I do kind of a combination of that because I'm in a very small practice and I have no one to cover but me. Sometimes it's difficult to get away for conferences. And so a lot of
Mhm,
times I will buy packages of, the Symposium on Advanced Wound Care and sit at home and just go through the different conference educational sessions. I'll look for webinars at times online that I can jump into. The Northwest Telehealth Resource Center does provide some free education, and so I get some information from them as well. Um, I haven't been as involved with the American Telehealth Association just because their stuff has not ended up being as convenient for me, and it didn't address the type of patient that I was trying to see. They're usually, rural hospitals that are trying
yeah.
to link into care, or they're large facilities in Boise, or I mean, Boise's big for us, but but areas that are not necessarily underserved, they're reaching out to small communities, and so their clientele didn't really touch the people that I was looking at reaching. And so I tended to look more for the rural conferences that dealt with rural health. And so I haven't identified other great areas, but the Northwest Telehealth Resource Center has been a good resource for me.
Let's see. Okay. Um, not so much magazines or blogs or
No, because I'm an older person, I don't tend to look at blogs as much. But if somebody were to send me a link to a blog, I'd read it.
Mhm.
Yeah, VSee I know has a wonderful blog, and I actually don't see it because I don't think I ever got a link to it. Um, but if I
Well,
had a link, I click on it.
well,
So a lot of my
honestly, yeah.
Yeah, so a lot of my information would come from my email saying, "Hey, look at this on, your link to the wound care person. I'll look at that one because I can click on it. If it
Hmm.
takes me more than a couple of clicks, I'm lost." So
Okay, so email is also a good way for you to get when you get
yeah,
forgetting information.
yeah, emails and honestly, text messages. I actually will look at a text message blast too to say, "Hey, we've got this located on such and such a place." If I can read it in 30 seconds or less, I'm in.
Okay.
The other thing that I'll sometimes do, honestly, most of the time, if I get a good link by email or text, that is a good place to go. Otherwise, when I'm researching online, if there's a condition that I'm researching, or there are different wound care websites that I'll go to look up stuff, whether it's my certification organization or whoever, I'll also look on their website information.
Okay. Let's see. So, okay, I'm moving on to like purchasing questions. So when
Okay.
you guys made a decision to purchase VC, who had to be a part of that decision? Like who and
Um,
how did that decision process kind of look like? How did it happen?
Okay, well, basically what we did was there was myself and IT, and my office manager was a part of that, and our medical director was a part of that. So the four of us got together, looked at the different options, looked at the benefits and drawbacks of the different systems, and very quickly ruled out the hyper expensive programs because we didn't have the funding for it and didn't figure it was going to be sustainable starting out. And the four of us would just talk about which ones we thought were the most likely to work, and VSee came out as the most likely candidate for what was going to work for us.
Do you need to answer your VC? I think I just did.
Yeah, you heard it pop again, didn't you?
Yeah, it's like I have this immediate reaction because we use VC all the time. Like, oh, I need to
Oh,
see this.
there it is.
Yeah. I can tell you a story about that sound.
Here we go. All right, she's tucked in.
Yeah. So who did the research for did all of you do the research, or did everyone kind of pitch in to do some research, or
Yeah,
did one
there
particular
was
person?
myself, and we had a person that was kind of designated as a coordinator for the program. And we had enough staff at that time. We had, I don't know, about 12 people on staff at that time. So we had some extra people that we could designate to that. And they did some of the research as to different programs and laws and rules and all that kind of thing. And I did a lot of the research, and Becky also helped with finding equipment as we got it narrowed down to, okay, this program would work. How do we make it work with this device? So once we had narrowed down to the program and stumbled around with how does this work with a computer, but this doesn't work well training on a computer, what else can we do? Once we got it down to that point, then it was mostly mine. So
Okay, so then that's down to you four,
yeah.
four main people.
So, and I'm sure that there are holes if people want to get really fine-tuned with it. I'm sure there are holes in what I've done. I am I'm not perfect, and I wasn't trying to be. I just want my patients to get seen.
I don't think anyone was looking for. I don't think anyone's looking for the holes.
Okay.
Yeah. Um, Okay. And let's see. And for the research, were you all using mostly the internet, or did you use
Yep.
another way? Okay.
Yeah.
So you just kind
Yeah,
of did
mostly
Google's.
internet. I did a little bit of research using the hospital's librarian. You know, she looked up some stuff for me, but I found that the people that were not invested in the program weren't really motivated to look for anything. And so, so, you know, in my spare time, I would just read articles, and the doctor I worked with would find articles. She does get more information from medical journals than I do.
Mhm.
She subscribes to, I think it's a house call providers. Um, American House Call Physicians, I think it is. And she had actually seen some information in there about telehealth. I was kind of surprised that she had passed on articles to me. And some of them, the information was not as current as what I was finding online and through the Northwest Telehealth Resource Center.
Mhm.
So, you know, but it was there, and that was encouraging.
Yeah, we had someone at our conference, a PBS um, uh, producer who he actually does. He he said it's the longest running healthcare show in the U.S.
Wow.
So yeah, and he got into it because of uh, the Surgeon General at that time, Everett Koop. So
Yeah.
I guess he convinced him. So he was doing these Marlboro, I can't say it, ads at the time, and Everett Koop was trying to get rid of smoking, and so he actually brought him in and convinced him to like go into health advertising. And so
Wow.
yeah, and so he started advertising for doing a magazine for home health, and so
Wow.
yeah,
That's,
it's been and he kind of sees the parallel between the home health movement back then and
yeah,
telehealth now. A
there
lot of
is.
pushback, and
Yeah.
but people were doing
Well, and
because needed to.
I'm curious as to if marketing through some of the AARP magazines and some things like that might actually be an interesting move, because more of the people my age, the baby boomers,
Hmm.
are going to be on the upsweep here.
Hmm.
And more of us are at least a little tech savvy and are getting more computer literate, or, you know, using smartphones, things like that, that the previous generation didn't do as much. And so I think you're going to have a pretty large market in that arena with the
Hmm.
boomers that know how to use a cell phone, know how to send a text message, communicate with one another, and communicate with providers using,
Hmm.
you know, cell phone faxes and cell phone programs of different types.
Yeah, yeah. My mom likes her cell phone too.
Yeah.
Do you have like a favorite online shopping site, or like do you do any online shopping or online purchases?
I'm terribly yes, yes.
Okay.
I currently use Amazon.
Okay, so the Amazon's your favorite.
Yeah, we joke a lot about my daughter and I. My oldest daughter got me started on that. And
Uh-huh.
if it doesn't come from Costco or Amazon, it just doesn't happen. I'm
Yeah.
not a big shopper. I don't have a lot of time for that. So, yeah.
Yeah. Is there, I mean, I guess what is one thing that you like about the Amazon experience?
Because I can sit in my recliner and shop for things. I don't have to run out in the snow in Idaho to find, and to research and compare products. You know, I know that some of the ratings on Amazon are not entirely accurate because they're pumped
Mhm.
up by this or that or the other. I know there are programs where you can buy likes, you
Mhm.
know, but the reviews are helpful. And so if I have a review that is written in good English, I know that it's probably a reliable review. And so I look for those, and I can research products and see what other consumers thought of them, and see whether it's something that I think would work for me because it was a user-friendly item, or it was a durable item, or whatever it is, you know.
Mm-hmm.
Those things at least give me a little bit of a jump start on it. Whereas if I even go to the mall, which I never go to the mall, if I go there to look at a product, I have to do the total pick up, evaluate, turn over. Does this work? How does that work? Ask the person at the store, well, show me how that happens. And, you know, what if this goes wrong? You know, what do I do with that? I can kind of research that stuff ahead of time, and I actually do research things that I'm going to use a lot of times going online and looking at, you know, well, what happens, and have other people had this break, and all that kind of stuff can be looked at ahead of time.
Okay, great. I think those are most of my questions.
Okay. Yeah, so even with the, you know, what's your role question, yeah, it's pretty much, because we're a small, very small practice, I pretty much do all the moving pieces. And so whether it's marketing, IT, purchasing, development, protocol development, hiring, you know, whatever it is, yeah, I'm involved in some part of that. So.
Oh, I that sounds a little bit like VSee.
Yeah, well, I kind of wondered, you know, about how many employees VSee has.
Yeah, we've actually grown a lot in the past year, so we're kind of in growing pains mode. So right now we have about 50 people.
Yeah.
We're still largely programmers though, so the business side of things is still fairly small. It's like, I think it's like 5 or 6 right now. Milton's trying really hard to grow it, but
Yeah,
it's tough.
it is.
Um,
Well, and kind of figuring out your niche, I think, is a little challenging.
oh my
Because,
goodness, tell me
yeah.
about that. I think we keep changing our minds every 3 months.
Yeah, that's the hazards of being a small business. Yeah, we went through that because we started out with, you know, the 2 providers actually, 2 providers and 2 office staff, and then we swelled to about 15. Went through reconstruction and move and regroup and move this over there, and now we're back down to 4 again. But we've got a lot better program design, and I think there are times where you kind of have to pull back and look at, okay, where am I going in 5 years? And once I've got where I'm going in 5 years, if it's, you know, not the nursing home or whatever, then we can kind of speak to what am I doing today and why am I doing it. So we had a wonderful small business association coach that really kind of helped us through our own growing pains and to focus down on what was important and what the niche was that we wanted to fill. Because for a long time, we were struggling to figure out what we were really called to do versus what other people in our community could do. Because there's a lot of people, honestly, in our community that can provide medical care. There are not a lot of people in our community that can provide medical care to homebound clients. And so that was our niche. So,
I feel like Milton doesn't have like one specific coach, like he just kind of listens to a lot of different things, and so.
oh man, this particular guy, his name was Bill Jung, and so he's Korean. He had just been such a blessing to us, I'll tell you. We can't say enough about the Small Business Association here. We had won a award for our community about, you know, being a great up and coming. We had no idea who nominated us or why in the world we got the award. But as part of that, they offered us free business training because, you know, you have a doctor and a nurse practitioner. I never intended to be an entrepreneur of any sort. I just wanted to see patients. Zero business training, I'm sorry. Don't ask me about a balance sheet. I've got people that do that, thank God. You know? But for him to walk us through structuring a business, developing positions, not just finding people to plug into the positions, because I'm one of those people that I tend to love the people that work for me, and I would try to find positions that fit them instead of finding the position and then finding the person to fit the position. Does that make sense?
I think I know what you're saying. I think I just need to wrap my mind a little bit around it.
I would have all these nice people working for me, and I would try to put the nice person in the position that was not a fit for them. And so instead of finding what the business need was, and then
finding the person
who fit that need. Yeah.
I see.
So I'm not a very good business person. But I'm learning all the time. So probably by the time I retire, I'm going to be pretty good at it.
And they can start giving the rest of us more advice.
There you go. I'll say, go talk to Bill Jung. He's awesome.
Yeah. Well, I saw that you're like a faith-based, that you're faith-based business, and so
yeah, we're a Christian business, and so yeah, we had some. I don't know. We had some incredible stuff happen along the way. I can't speak enough for the things, and just honestly, the things God has done for us over these years. We had at one point, and again, because we're lousy business people, but great hearts, we had a $76,000 shortfall in our budget for the year. And so we got our employees together, and, Bill helped us to figure out how we're going to navigate this. And with all of the cuts that we made, we were still going to have to let people go, and we did let some people go. And it was a very tragic and painful time for me as somebody that really loves people. But as we kind of assessed our situation and thought, man, this is just not going to go. So we all prayed about it. We got together and just dedicated ourselves to, okay, Lord, if you really want this to work, we need you to show us how, because we can't do it. One of our staff members was looking at the Medicare requirements for electronic health records, which we were just instituting at that time, and found that we happened to qualify for an $80,000 payment to start electronic health records. We qualified that year and came through it with flying colors. And it was just one of those, okay, wow, we'll just keep going. Okay. Don't know how you did that, but awesome. We'll keep moving then. And each year, we continue to wonder, don't know exactly how this is going to look and how this is going to work, but he seems to continue to provide for us in some really beautiful ways. So.
Amen.
We've had some pretty cool stuff happen. One of the things that our dementia patients tend to lose, and this is totally off of VSee in many ways, but we had a resident with very advanced dementia, and so a lot of times he would just scream, he would hit at people, call out. But one of our volunteers went out with an iPad loaded with music and some different stuff to do with residents, and so he said, well, I'll just wheel the guy around for a little while, and he put him in the wheelchair, put some music on, and Music and Memory has some amazing stuff too. There's actually a PBS thing, a documentary that was done about that. Put him in the wheelchair, put some music on, they're wheeling around the facility and going around, and he finally kind of settles down a little bit, and he puts his feet down, and the resident says in a full sentence, I know that song. And so the volunteer stops with him and he says, well, let's sing that. They sang the whole song together, and at the end of it, the resident looks up at it and he says, do you think God still loves me? And we were like, well, I'll tell you what, yes, he does, as a matter of fact. And so the guy prayed with him, and the fella settled down for the day, and he was fine. but just being able to connect what's going on inside, you know, those painful emotions, and what is it that's going on inside with being able to communicate that emotion to the outside is huge and amazing. And I told folks at our fundraiser this last week that a lot of times we really do kind of move sightless among miracles. There's a little poem about a prayer. It's a Jewish prayer, actually, about how the days pass and years vanish and we walk sightless among miracles. And the prayer continues, you know, Lord, open our eyes so we can see these things going on around us. And just the opportunities that we've had these last, it's almost 10 years now that On-Site for Seniors has been in business. And the things that we've seen and participated in, just honestly, miracle after miracle, whether it was family reconciliations, healing, provision of money, provision of care, provision of VSee. I mean, I can't begin to tell you the number of connections that have happened because we asked God for them. And again, it happens. So that's just kind of where we've been.
That's really neat.
Yeah.
And I think we don't, what was I going to say? But, well, I think in healthcare especially, right, there's so, you know, I think most people go into healthcare because they want to help or they want to,
Yeah.
you know, do something, and then, and
yeah. Well, and with the age group that we work with, a lot of them are never going to heal. You know, healing is not the object many times of what we do. Healing in the physical sense. So I'm looking at the patient from a whole different lens. It's not just healing in the physical sense. Looking at the wound is an important thing, and it can prevent an infection and bad things from happening. But if I miss what's going on with them emotionally, spiritually, financially, relationally, all these other areas of life, I've really missed the healing required for that individual. So there's a whole lot more to it for the elderly than just fixing the wound. Fixing the wound is an important thing, but fixing the heart is a whole different ballgame. And one of the things, honestly, that I've appreciated about VSee is it allows that interaction. I'm not just looking at the wound. It's, you know, oh, hi, Marge, you know, how's it going? And, yeah, you're looking good today. Did you win at bingo? Whatever, you know. Yeah, tell me about what's happening. And it's a whole different relationship piece. And she can see that I genuinely care about Marge, not just Marge's foot. So it's an important touch. It allows, and one of the things we talked about at our fundraiser is that it's not just the number of physical visits, it's the number of touches that are important to us, whether it's the thousands of volunteer touches by video, by going to the facility, by whatever it is. And we are using VSee for, there's a couple that the husband is in the hospital, or the wife is in the hospital, husband's in the nursing home, and we're going to try to connect them by VSee also. So it provides touches in other ways as well. So there you go.
Very cool.
Yeah.
Well, thank you so much for all your time. I know we had kind of a marathon session today.
That's all right. Well, I appreciate your willingness to listen, and I hope some of it somewhere there is helpful to you. So.
Oh, I think, yeah, it definitely is. Okay, let's see if I can figure out how to exit from here.
Okay, so and, I end this session.
Well, I think I'll end the session, but just so for the webinar next week, you'll be at this location still, right? So we don't need to do another audio video test.
No, if this sounds okay and works okay, I'll just stay here. I'll make sure that I have the junk out of the background and all that. So,
Okay. And maybe just have your phone by the side in case we have
yes,
any, um,
any audio
yeah,
difficulty.
Wi-Fi issues.
Okay, yeah, and I wrote down the code number for this so I can dial in if I need to and there's any problem and we need to separate it.
Yeah,
So,
great.
okay. Well, thank you for your time and I hope your day is blessed, whatever you do next.
Thank you.
All right. Well,
And
take
we'll
care.
work on time management.
All right. All right. Yeah, I'll be praying about that. Well, take care.
Bye.
Have a great day. Bye-bye.
Okay. And